My name is LuWenn Jones, and I'm from Cedar City. My husband and I raised our family there. We have 3 children, and our middle daughter, Elaine, is significantly impacted by intellectual and behavioral disabilities as well as mental illness.
In our home, we use the word crisis carefully. Since our daughter Elaine's premature birth, her life has been defined by one crisis after another. A diagnosis of autism came at age 2.5, and that felt like a crisis. Puberty, followed by a diagnosis of bipolar at the age of 12, was a constant sleep-deprived state of chaos and crisis for years. At age 16, we added seizure disorder to her list of diagnoses. Then a series of illnesses over the next 2 years caused immune system issues that sent her into a serious bipolar crisis that lasted more than 6 months and led to 2 inpatient psychiatric hospital stays in Salt Lake City. With no resolution to her mental state and the realization that we simply did not have the proper resources in Cedar City to stabilize her, we made the horribly difficult decision to place her at the Utah State Developmental Center in American Fork for stabilization.
Elaine has been in provider services for 7.5 years, residential provider services. Prior to that, she also received some after-school program services through a provider. And I would say staff turnover is just the expected. It's just the norm in this particular industry. It became harder and harder to hire people, and the hardest part of that is the training, because it takes a long time to train people.
In those years, we have watched countless direct care staff come and go from Elaine's program. Some of them are not even there long enough for me to learn their names. Others have become close friends and form real attachments to Elaine, but inevitably they move on.
So not only is there high turnover, but there is just a lack of workers. And so those who are still working are having to work much longer shifts, extra shifts. They're doing it with less experience because many of them have only been there a short time. There's a lot of burnout. You've probably heard the term caregiver fatigue. I'm well acquainted with that feeling. And our direct care staff experience that as well. That if they work too many hours or too many shifts or with very, very difficult people without a break, then they experience burnout.
They are attracted to the job because they are good-hearted, kind, compassionate, and loving people. Some have a true gift for connecting with Elaine and advancing her skills and goals, but I cannot fault them for pursuing other career opportunities when their beginning wages are relatively low, even in a better economy, and relative to the difficult work they are tasked with. This crisis we now face in the provider system did not happen suddenly. It is the culmination of years of underfunding combined with the sudden effect that the pandemic and changing economy have brought, with the resulting rapid changes to cost of living and the landscape of our workforce. Please hear me when I say that direct care with individuals who have significant support needs cannot be done remotely. It is hands-on, 24 hours a day, 7 days a week, and 365 days a year. Disability does not take time off. It doesn't go away for holidays. We can't delay or postpone meeting these needs because we are in a pandemic and there are other competing needs. It is immediate and in our faces every day. In the past 1.5 years, Elaine's house has undergone so much turnover in staff and house managers, I'm losing confidence in their ability to properly care for her. Last Friday, I received word that yet another house manager who had only been there several months was quitting, and a new house manager had been selected from the direct care staff. I've only met this staff a handful of times as she only works with Elaine in the mornings. She knows little about the other 20 hours of Elaine's day, her communication, her routines, her complex health protocols, and medication management. Many things are slipping through the cracks because of this kind of turnover. Instead of having a new house manager every 2 or 3 years, this will be her 4th change in house management in 8 short months. The staff continues to get younger and younger, less and less equipped to handle the complex needs of Elaine, her roommates, and others in the system. What will happen to Elaine and others like her? The funds that are being requested now to allow providers to pay direct care staff a starting wage of $17 an hour is an important, critical first step, but that's all it is. It's just the first step to save this vital infrastructure in our disability system. It's frankly time for us to recognize that we can no longer, in good conscience, ignore the needs of individuals with disabilities in our state. We can do more. we can do better. Our disability system was barely above failing, and now we are failing.